Hello, guys. Good day. This is Anna of Reinforce Me Club. Today, we're going to talk about the number one leading cause of death among Filipinos in the Philippines 2023, according to Philippine Statistics Authority and Statista. The winner is ischemic heart disease. Now, I'm not sure if that's a good news though, but let's get to know this thing since there's a lot of people who are victim of this. Now, ischemic heart disease, we also call this as coronary heart disease or coronary artery disease. Now, let's get to the nuts and bolts of this thing. Now, when you say ischemic heart disease, it means that your heart is not getting enough blood and oxygen because of the narrowing of the arteries, which supplies blood or circulation towards your heart. It also means that there's a buildup of plaques which are made up of fats, cholesterol, or clots on the linings of the artery, which is also called as atherosclerosis. Atherosclerosis means that the artery, there's a hardening, abnormal hardening of the artery. That is called sclerosis. So arterial sclerosis. Arteriosclerosis that actually comes out during ultrasound or x-ray if you ever have one. Now, when there is a narrowing of the arterial lumen, that results to the decrease or reduction of blood flow towards your heart. Now, another thing about ischemic heart disease in the Philippines is that this is one of the most non-communicable disease next to CVA or stroke, cancer, and diabetes. There you go. What are the signs of ischemic heart disease? Number one is chest pain. When the patient comes into the hospital, this chest pain is described as pressure, fullness, squeezing, or pain in the center of the chest, like that. This is due to the situation in which the heart muscle works harder during physical activity. Some patients would describe this as if like there's some kind of elephant sitting on their chest. This can be relieved by rest and medication. Well, speaking about chest pain, in medical term, chest pain is called angina pectoris. And we have two types of angina pectoris. Number one is stable and number two is unstable. Stable angina can be relieved by rest and medication, and it will be gone in a short period of time. Unlike unstable angina, this type of chest pain is totally unpredictable, and it can be relieved longer, in a longer period of time, even with rest and medication, compared to stable angina. Another symptom of ischemic heart disease is shortness of breath, especially when a person or a patient exerts effort to reach something or to do something. Another one is palpitation, fatigue, and sweating. Now, what can you do about this? Well, let's get to the point of this conversation. Now, one thing you can do is to know the cause. We have two risk factors which bring about ischemic heart disease. Number one is the non-modifiable factors, which means that you can't do anything about this. This is already pre-existing since the day you were born. Number one is aging. So, ischemic heart disease is common among people who have the age between 50 to 65. Another thing is family history. So, if you have a distant relative or relatives who have uh, coronary artery disease, you could be prone to this. Just prone to this. Another one is sex. This condition is common among males and a rising cases of females post-menopausal. Lastly, genetic predisposition. And the other factor, which is the modifiable risk factors. This aspect actually needs your full commitment to change your life if you have to. These are smoking, hypertension, high cholesterol level, obesity, diabetes, physical inactivity, stress, depression, sleep apnea, pollution, and alcoholism. The complications that await for ischemic heart disease are heart attack or myocardial infarction. As as the heart tries to compensate at the best of its ability, it will just turn like gone, gone off. It reached to its peak compensatory mechanism to heart attack. So patient usually just like gone when this happens, and this is life threatening. That patient needs to be revived. Another thing is congestive heart failure, cardiac arrhythmias. So when you have cardiac arrhythmias, it means that you are prone to developing thrombus, which may travel anywhere else in the body or towards the arteries of your brain, causing stroke. And then aneurysm. Aneurysm in the parts of ventricle, septum, or any papillary muscles. Now, how can we resolve this? The number one thing that you can do and you can keep in mind is prevention is better than cure. Here's how it is. When you are at a certain age of like 50, or when you feel like you are far beyond in taking care of yourself, have an annual or regular checkup with your healthcare provider. Have your bloods taken, if necessary, x-rays, echocardiogram as needed, get it if it's available. To have a look at your current health status. If, to be able for you to evaluate if you need to make an effort to improve your health or just keep yourself healthy in a current condition. Another thing under prevention is lifestyle modification. It's easier said than done, but your health is your choice. Nobody can save you. It's just you in terms of your health. This is personal. This is a personal responsibility. So, if you have, you have unhealthy diet, it's time to get enlightened and start your healthy diet, some kind of, life-changing thing that you can ever do for yourself for the sake of safe self-love. Eat healthy, have a routine exercise, even just simply, walking or jogging at your own pace. By the way, if you have underlying heart condition, have yourself check with your healthcare provider first before, signing in to this workouts. Because if you have underlying heart condition, there might be some limitations that you have to consider. Otherwise, if nothing, then go. You need to do smoking cessation. And if you can't stop smoking, it doesn't mean that you don't deserve a good life. Everybody deserves the best life ever. But you have to, yeah, of course, you have to enjoy the pros and face the consequences of smoking until such time that you might going to change your mind and stop smoking. The same is true with alcohol. If you have regular drinks, like 1 to 2 glasses daily, you might want to taper it. Could be 1 glass 2 to 3 times a week, up to 1 glass weekly, or half a glass weekly to 1 glass monthly. So it's up to you. That is lifestyle modification with self love. Another thing is weight management. Now, let's get to this weight management thing. The goal of weight management is actually to accept your new lifestyle with all these healthy habits, with all this new diet that you have, new exercise routine, not to simply lose weight at a certain amount of weight for like 3 to 5 months. You want to lose 10 to 15 kilos in 3 to 5 months. And then that's not the end of it. You have to accept the new you that you have decided to be. And for patients who are having hypertensive medications, it's time to take them religiously to control your blood pressure, plus dietary modification and exercise, regular exercise. The same is true with diabetes, sugar control, lifestyle change. Number two is, of course, if you already have a coronary artery disease, take your medications religiously. And if your blood pressure medication or blood pressure medication is not working, you need to, have it consult to your doctor. If you ever need to have some, adjustment of change of medication as needed only. Number three is to seek family support. Seeking family support means you have to get your act together, have a good relationship with people around you, especially those who love you most. Go back to your life purpose and find your big why you still want to wake up every morning. What's your reason? What are you here for? To be able for you to effectively accept the fact that you have to alter your life. It could be a little bit or really stop smoking, you know, stop drinking. This is a life changing decision. So get your act together. And lastly, participate in the cardiac rehab program. This program actually have a structured approach to physical activity, education, and support that you need from individuals with heart condition. Always remember that your health is your choice. The key to wellness is to accept your personal responsibility for your health and well being. Have a lovely day ahead. This is Anne once again from Reinforce Me Club telling you you never lose, you either win or learn. Thank you very much for your time.